advanced health nurse practitioner, and let's talk about the Depo shot. This isn't what I've talked a ton about. I have worked in practices before where I used it a ton, and now I just don't use it that much. So it was kind of an afterthought, but it is a very, very common form of birth control, and we should talk about it. So what are the benefits and the downsides of the Depo shot? The benefits, there are many. It is a very effective form of birth control. It is about 94% effective on average because there is operator error involved. Someone might not get their shot on time, but if used exactly correctly every single time, it could be up to 99% effective. So not too bad. The dosing schedule can be a positive for a lot of people. You need a shot 4 times a year. It is effective at preventing pregnancy for 13 weeks. So that's where the operator error comes in. Someone could miss their shot, but 4 shots a year is not too bad. For a lot of people, that's easy if they live like close to their clinic or they're going to their student health center or something like that. That dosing schedule for some people isn't great. They're like, well, why wouldn't I just get something like that I can control myself and I can take every day, or that's truly set it and forget it? So I get both sides. And then some people actually are able to inject it themselves. That used to be really popular. Then I feel like it kind of fell out of favor. And then during the pandemic, it became popular again. We did injection teaching for people via telemedicine, and people started injecting themselves again, or having like a family member who is in the medical field inject them too. So lots of options there. There's also some benefits for some people when it comes to bleeding pattern and controlling heavy menstrual periods, but we'll get into how that it's a tough one pretty soon. So we know the benefits: effectiveness, the dosing schedule, and the downsides can also come with that too. There are things that are more effective, like the IUD, like the Nexplanon, like a tubal ligation or a salpingectomy. And when it comes to the dosing schedules, for some people that's really not convenient. The downsides, the biggest downside when it comes to reasons why people actually stop using it is typically irregular bleeding. We always say that Depo is a 2-time trial. So often after your first injection, you will experience a lot of irregular bleeding. And we do not know what your experience is going to be. You could have irregular bleeding for a few weeks or even a few months. So that's why I would say, okay, get that second shot. And then after that, if it's time for your 3rd shot and you really still don't like it, you've still been struggling with irregular bleeding, maybe it's not for you. But it's so common to have irregular bleeding at the beginning that we often tell people get 2 shots. So maybe you've got your 2 shots, you're still having lots of irregularity, even if it's light. You're like, I don't know if this is going to stop, so this doesn't work for my life. Okay, that's where a lot of people end up switching. The other consideration would be, how heavy is your irregular bleeding? So someone might start the Depo shot because they have heavy menstrual periods related to fibroids, or they just have a history of heavy menstrual periods. Well, they could experience irregular bleeding that is heavy for months. And of course, we don't want that. That patient can struggle with anemia. They can struggle with a lot of things. So the irregularity is often a reason why people quit the Depo shot early. Now, some people will not experience that at all, and we don't have a good indicator as like, oh, like, fill out this survey and we'll figure out, like you answered A, B, and C, so therefore you are not going to have irregular bleeding. We have no idea when we get started, so it really is trial and error, which sucks for patients, honestly. But there are people who will not have that irregular bleeding pattern. For some people who love their Depo shot, they will have very little irregular bleeding, and then their periods will stop altogether, or they'll just get a period in that week or so before their next shot is due. So that's where those people who love their Depo shot, that's typically what they're experiencing, is very, very little periods, if any at all. And if they do happen, it's just a little bit right before their next shot is due, and they say, oh, well, next, due for my shot anyway. So what some people, though, have heard about and is a very common concern is bone loss related to Depo or weight gain. So there is evidence of weight gain with the Depo shot, but on average, that weight gain is 5 pounds or less. But everyone's personal experience is different. There are patients who are like, I've changed nothing in my life and I gained 20 pounds plus. So if you are very, very concerned about weight gain, then Depo might not be for you. But if you I had a patient start Depo because she wanted to gain weight. So it depends on the person. But knowing that in broad sweeping generalizations, it should be a very small amount. But if that is a very high concern for you, that might not be the method for you. But back to bone loss. Now, I looked at a couple different sources here because we were always educated, Depo might not be for someone for a long amount of time because of the risk of bone loss. But different organizations have put out different guidance. So the FDA recommends Depo use for 2 years or less, no more than 2 years. But ACOG, which is the American College of Obstetrics and Gynecology, doesn't have that same recommendation. They said that Depo could be used in the long term. So some of this is ACOG is recognizing that the studies on long-term bone density loss are small, and the risk of unintended pregnancies could potentially outweigh the risk of potential fracture in the future, because we don't have a lot of really large studies that look at use of Depo in the long term, like from puberty all the way through up until menopause. They did do some small studies, but again, they're smaller. The biggest studies they have show that there's bone density at the beginning within the first year or two, and then that typically stabilizes, so you don't continue to lose bone density. But if you're someone who's already the picture of osteoporosis, you are a small-framed female with fair skin, maybe Depo isn't for you. If you are going to use Depo and your goal is to use it in the long term for whatever reason, then what would be really important is to engage in weight-bearing exercise. So walking, hiking, jogging, and resistance training, to name a few, would be helpful to maintain your bone density, and having that nuanced discussion with your healthcare provider year after year if this is still safe for you to continue. So I hope that was helpful. Depo can be a little complicated. It can be some people's favorite thing in the world. It can be some people's bane of their existence and the cause of lots of irregular bleeding, and they strongly dislike it. One last consideration before I go. The Depo shot might not be for you if you are intending to become pregnant very soon. Once it stops your cycles, it can take a few months for them to come back to normal, and it's such a gamble. There are people, they stop their Depo shot, they don't get their next one, and they get pregnant very quickly, and there are some people where they could take almost 1 year to resume normal menstrual cycles. That's just the effect of the Depo. Their cycles will come back, but it could take a lot of time. So if your goal was to get pregnant within the next year or two, Depo might not be for you, because you may have a harder time resuming your normal cycles right away. So just some things to consider. Again, I hope that was helpful. Don't forget to like, comment, subscribe, and let me know if there are any other topics you'd like me to cover. And remember, there's no such thing as an awkward question.